Hello all, this is Dr Dheeraj Masapu. For people who don't know me, I'm a neuroanesthesiologist recently in the media. This is about a neurological condition faced by a celebrity, and she is Hailey Bieber. And this is about she getting a Ministroke in medical terms. There is a 15% chance of young people getting stroke, according to statistics. So be aware. A diagnostic criteria for transient ischemic attacks. So how you differentiate stroke and transient ischemic attack is?
Recently started birth control pills, which I should have never been on because I am somebody who suffered from migraines anyway, and I just did not talk to my doctor about this. So ladies, if you suffer from bad migraines and you plan on being on birth control pills, make sure you tell your doctor, because having a stroke is a potential side effect from birth control pills. The second thing was I had recently had COVID, and that was something that they thought was a contributing factor. And then the third thing was that I had recently gone on a really long flight. I had flown to Paris and back in a very short amount of time. And I slept through the whole flight both ways, didn't get up and move around, never thought about wearing compression socks. So basically, all of the doctors came to the conclusion that it was a perfect storm that led to me having a small blood clot, and that was the conclusion. So they still didn't know necessarily how the blood clot traveled to my brain. So when I went down to UCLA, we did some more in-depth testing. And when I went there, they did something called a transcranial Doppler, which is basically a much more accurate test to find a PFO. And what they do is, similarly, they do the saline with the bubbles, they inject it. But with this test, they listen for the sound of bubbles escaping in the heart. If they don't hear anything, presumably you don't have a PFO. If they hear a little bit.
So since they didn't find anything in the bubble echo, they have discharged her, but she got it out and she went to another hospital, and here they're trying to investigate the possible causes for young person getting a stroke. One is a known thing, that is OCP or oral contraceptive pills. Whoever is taking are more prone for developing strokes and CVTs in the brain. That is a known thing. I didn't understand what is the relation between migraine and OCP pills. Let us not go into that detail. And the second thing which she clearly mentions is she's gone for a long travel. So, long travel in the flight, there is movement of the legs won't be there. So there is a risk of deep venous thrombosis or blood clotting in your legs. So that is one of the reasons for developing stroke. Only if you have a communication in your heart. Otherwise, the clots usually get stuck in the pulmonary circulation. So the history favors that there is some kind of patent foramen ovale or communication in the heart. But a same stroke in an older person, you need to think about the causes like atrial fibrillation, where some part of the heart is not beating, and some kind of clots will develop in the heart. And the second thing, most commonly in aged people, we think about is the carotid plaques, which directly go into the brain. So these are the things we think about in older people. But since our history is typically pointing out towards a patent foramen ovale, even the bubble echo was negative, they are going for a further testings.
You might have one, but it's small, and if they hear tons of bubbles escaping, you have one, it's probably large. So I did this test, and they actually found that I had a grade 5 PFO, which is the highest grade that you can have. So mine was fairly large. But at this point too, I was just grateful that they found it and that they knew that it was there. And also the conclusion was that I had a blood clot that traveled into my heart. And instead of what typically happens if you have a small blood clot is that the heart will filter the blood clot to your lungs, and your lungs will absorb it because the lungs are so big and they can handle it. What happened with me is my blood clot actually escaped through the flap or the hole in my heart, and it traveled to my brain, and that is why I suffered a TIA. So the recommendation from my doctors at UCLA was to have a procedure done called a PFO closure, which is when they go through your groin, through the femoral vein in your groin, and they travel up to the heart, and they put this small little button. It looks like a little button. That buttons close the flap in the heart, and then eventually your heart tissue grows back over the closure device, and and that's it. And then you have it forever and you continue on with normal life. So I recently got the PFO closure done and it went very smoothly. I'm recovering really well.
So now in the UCLA hospital, what they did is they did something called as a transcranial Doppler. So transcranial Doppler is a kind of a test where we insinate the vessels like middle cerebral artery, anterior cerebral artery in the brain. So you keep probes outside. Through ultrasound and Doppler technology, you can check the flow velocity within these vessels. I have done that multiple times, and we do that regularly in stroke and also in other conditions called as subarachnoid hemorrhage to look at the vasospasm. So here how it is useful in PFO is, as she explained in this, when you inject bubbles into your blood circulation, if you have a patent foramen ovale, then they cross the heart, go to the brain, and you can hear some sounds called as high intensity signals in the transcranial Doppler. You can see in the image here. So this is how a high intensity signal looks like. So when these are present, then it is confirmed that there is a patent foramen ovale. After that, to confirm, maybe you can select the patient and go for a transesophageal echo to plan the proper procedure and also get the measurements done.
Really fast. I feel great. The biggest thing I feel, honestly, is I just feel really relieved that we were able to figure everything out, that we were able to get it closed, that I will be able to just move on from this really scary situation and just live my life. And it was definitely a really eye-opening thing for me. I definitely felt a lot of anxiety through the situation because from when the TIA happened to when I had the procedure to close the PFO, I just was really nervous a lot of the time about having another TIA or experiencing those symptoms again. And then I would get really bad anxiety, and my anxiety was kind of making me feel funny. It would make my fingers and hands feel kind of tingly. And I just honestly had a really, really hard time in the in-between. So ever since the TIA, I have been on a blood thinner and aspirin every single day. And I was also having an issue with the blood thinner medication because it was exacerbating my anxiety. It was making me feel.
So here, since they identified the cause, so what they have done is they have done a PFO closure procedure. Usually that is done by interventional cardiologists. I have seen few procedures during my training period. It is a catheter-based technique, and they deploy an umbrella kind of device near the patent foramen ovale, and it will seal the block. So that is done. And the most important thing you should understand here is prevention of further stroke. So that is what they have done. So if you don't prevent the stroke, there is some criteria called as ABCD, which you can see in this image. A stands for older than 60 years, and B stands for blood pressure uncontrolled more than 140/90, and C stands for your weakness, focal weakness and other clinical symptoms, and D stands for duration more than 60 minutes of stroke, and D is also diabetes mellitus. So if you have these kind of symptoms, then in the ABCD scoring system your score would be higher, and the risk of you getting recurrent stroke within 48 hours is more. According to studies, it is around 8%. So the most important thing you need to understand is whenever there is a mini stroke or transient ischemic attack, even though you become normal, it is not that you can go home and relax. So it is more like you need to find the cause and treat it, because you are more prone for a stroke within the 48 hours. So 8% is a pretty higher chance of getting a stroke, and some studies are even saying there is 20 to 30% chance of getting a bigger stroke for people who developed a transient ischemic attack. So once a stroke happens, then it's a different story. You need to go for mechanical thrombectomy or thrombolysis. Now most of the evidence is favoring pro towards mechanical thrombectomy. Even for that, there is a duration. I was telling you in the beginning of the video that attending a medical facility earlier is the most important key. Within 6 hours, you need to do mechanical thrombectomy. After 6 hours, it won't be much useful, even though now some studies are coming up where they're saying up to 16 hours it can be tried. So reaching the hospital is the most important thing. So in the beginning of the video I already told Just don't think because you're young you don't get stroke. Among the strokes, 15% happens in the young. So don't waste time. If some symptoms are there, reach the hospital and get the treatment. So this is the advice from the neuroanesthesiologist. This is not a very funny video, pretty serious video, but a lot of info I think I've given during this video. And if you like the video, then share it and subscribe to my channel. And as usual, Dr. Dheeraj Masapu logging off.